Students, are you ready? Give us one. Today, our topic is snake bite poisoning. You know, that is snake bite poisoning. It is obviously accidental in nature. When the people, they go in the hideouts, they go in the bushes, they go for hunting, or maybe at the time of floods, when the snakes will come out, and there will be a clash. The snake is going to bite, and this will be accidental in nature, and homicidal and suicidal is rare. Suicidal, there were only one case reported, was of an Egyptian queen. You must have heard about Cleopatra. Cleopatra was an Egyptian queen who has the beautiful eyes, was famous for beautiful eyes, and she got herself bitten by a cobra on her face. Homicidal is, modern world, and we have all kind of, atomic bombs, and we have laser-guided missiles. You just have to press the button, and you just have to aim with the joystick. If you are sitting somewhere, anywhere, and you are just controlling. So this world is having modern weapons, but according to our book, two of the countries were having fight, and one of the group started throwing earthen pots in another shape and carrying snakes, and the snakes started biting the people. But this is obsolete. Homicidal. If you put a snake in somebody's room, it is very hard, it is very difficult, it is impractical. So accidental poisoning is common. There are many different, interesting points in snake bite poisoning. The snake is such a stupid kind of animal, having no eyelid, having no nose, having no ear. It keeps on taking out its bifurcating tongue. In this part of the world, our ladies, they say those animals which have a bifurcating tongue, they are very poisonous. But I tell you, the snake can live without food and water under the ground for 6 months. The snake lays, few of the snake, they lay eggs, few of the snake, they give birth to young ones directly. Just like the fishes. You have the fishes in your aquarium. Few of the fishes, they give eggs, few of the fishes, they give the birth to the young ones. Male snake usually take care of the eggs. When the female, she goes for hunting, the male will start engulfing the eggs. Out of 300, 200 eggs will be engulfed by the male. This animal is just lying somewhere. But before we talk about it, there are nearly 3,500 species of snakes all over the world, out of which only 450, 500 are poisonous. In this part of the world, we have around 350 species of snakes, out of which only 50, 55 species are poisonous. Most of the time, when the snake bites a human, it's not a poisonous snake. Again, this is your duty, just like when you were doing the postmortem, you were the one who's going to tell the policeman who's standing outside what is the identification if it is unknown, person is unknown, time since death, cause of death, weapon used, etc. You have to mention them. You have to calculate time since injury, you have to calculate time since death. And moreover, you have to calculate what kind of a weapon has been used, if the firearm has been used, which firearm has been used, and what is the direction of the fire, and what is the distance. Being a doctor, you will say, it's very so difficult. It's very difficult to I've never seen the gun before, but this is your duty. Because on your observation, the case will proceed. Nobody's going to recheck it. I'm not going to come over there and recheck what you have written. The margins are regular, neat and clean cut, everted, or the margins are irregular, torn, inverted, or the wound of entry, wound of exit. And there is these days controversy going on for different cases in Karachi that the bullet entered from right side, left from left side. But later on, it was found that that it is a distant fire and it is from left. It got entered and right, it left the body. It's your duty. It's your duty to give these, findings to the policeman who's standing outside. On your observation, once you have an aseptic dressing, you won't be able to know whether it was by sharp cutting weapon, or it was by hardened blood weapon, or by it was a pointed weapon, etc., etc. So same way, in a snake bite, when the patient reports to you, you are the one who's going to decide whether to proceed with the snake bite treatment or just to stay away. As I was telling you that there are very few snakes which are poisonous. Most of the people, they die because of the non-poisonous snake bite. The person who has been bitten by a snake will die because of the fright, because of the anxiety, because of the tension, because of the shock. But the patient who has been bitten, maybe 1/10 of the patient will be bitten by a poisonous snake, and more than 9 patients will die because of the non-poisonous snake bite. What is the difference between poisonous snake and a non-poisonous snake? The poisonous snake, there are 2 teeth marks. Non-poisonous snake, there are series of teeth marks just like human has bitten. The poisonous snake, the habit is nocturnal, it comes out in the night only. Non-poisonous snake, it comes out anytime. The poisonous snake, the scales are all over the body, and a non-poisonous snake is only on one side, that is on the belly. The poisonous snake, and I think this, there are non-poisonous snakes, there are poisonous snakes, and in this part of the world, we have the poisonous snakes which are called with the name leopards or cobrides, viper or viperides, and sea snake. These are the 3 types of poisonous snake in this part of the world. As I was saying, that all over the world, there are around 3,000 species of snakes, and out of which only 10 to 15% are poisonous in nature. You must have seen in National Geographic or Animal Channel that there is a python, big snake. This python is not going to bite. Maybe you get frightened and maybe this is such a big snake. But this python, when it is somewhere in the water, and when any of the animal will go over there, will try to catch that animal will go around that animal and will start squeezing that animal. And when it will squeeze like this will produce traumatic asphyxial death. The diaphragm will not be able to move, and the person or that animal is going to die from asphyxial death. I hope you are with me. The snakes are found everywhere in the world. In few of the countries it is more, in few of the countries it is less. In few of the countries, the facility of treatment is not there, just like our country or our region. Few of the countries, they have snakes, but their facility for treatment is more. But there are few of the places where there is you will find no snake, that is in Antarctica. Each year, there are 45,000 incidents of snake bite in the United States. You know, we don't have any data over here in Pakistan, but we have tried our best. Nearly 7,000 to 8,000 are from out of this 45,000, 7,000 to 8,000 are from poisonous snake bite. On an average, 10 people die each year. The literally word for snake is by the old French word, that is to creep on the tree or somewhere. This is. So the typical word of snake stands for to creep. And this snake you must have seen everywhere in the monograms, everywhere on, except our PMDC. Everywhere they are just using this snake going over the tree or something. It is used for a symbol for medicine because of its relation to the Greek god of medicine, that is Asclepius. Okay. Cases reported in different parts of the world, in Asia, like Pakistan, India, Bangladesh, these places like Southeast Asia, nearly 237,000 patient has reported. In Africa, 90,000, more than 90,000 cases has been reported. And in Latin America, the 80,000 cases has reported. North America, there were very few cases, like 2,683 cases reported in previous year. In Pakistan, like 12,000 cases reported. And the total types of the snake world over, high incidence country, are given over here. In India, because it is 10 times bigger than us, they have more population, they have more poor population, and in India there are nearly 12 to 15,000 deaths per year. In Pakistan, it is nearly 1,200 to 1,500 deaths per year. In Africa, there are 1,000 deaths per year. In North America, in Australia, and European countries, facilities are there, and the people, they take care of their people, they get facility. And I give you example. Hardly we have any of the snake in Karachi. If the snakes are there, they are non-poisonous in nature. And few of the snakes are in the Mali region. But more snakes in Sindh are in a third desert. When a person or a female is being bitten by that snake who was under the sand, and the person or that female were passing from there and has been bitten by that snake. So more cases are being reported from third desert, and from third desert they will report to Umarkot. It will, take nearly 3, 4, 5 hours to report to Umarkot. And from Umarkot, they come to Mirpur Khas. It takes another 2 hours to come to Mirpur Khas. And from Mir Bukhar, it takes another 1.5, 2 hours to come to Hyderabad. It takes another 3 to 4 or 5 hours to come to Karachi. And the anti-snake venom will be injected after that. After that time, the poison has gone into the circulation and there is a swelling, inflammation, edema. Or maybe it was more dangerous snake. There is a ptosis, there is a paralysis, etc. And if it is a sea snake, sea snake bite cases hardly report to us. But so if sea snake, the person will be brought to Karachi, will take another 10, 15, 20 hours to come to Karachi because they are on a deep sea. So over here, we don't have a facility near to their places. So that is the reason the Western countries, they have a low snake bite cases and low mortality rate. As I said, there are 3,500 species, out of which 300 to 500 species are poisonous. Around 30,000 to 40,000 deaths occur annually, and more deaths you will find in India, then the Brazil, and then Burma, and then Pakistan. We will have, more deaths in this part of the world. There are, as I said, there are snakes, poisonous, non-poisonous. You are the one who's going to decide, looking at the patient, whether this person has been bitten by a poisonous snake or a non-poisonous snake. One thing more I want to tell you. If the person has been bitten, there is a laborer in the fields in agricultural lands called Hari. Hari knows each and everything about their area, what time these birds are coming from Siberia, what time these animals are coming towards us, what time these snakes are being appearing, what is their hibernation period, and etc. Maybe that Hari has been bitten by a poisonous snake at Fajr time when he was trying to divert the water on other side. When the snake bites that Hari on the right knee joint, that Hari maybe has bitten by a poisonous snake or non-poisonous snake. There are more poisonous, non-poisonous snake, and there are very few of the poisonous snake. But he insists, no, I have been bitten by a poisonous snake, that was a cobra. Okay? But it is not necessary that when the person has been bitten by that snake, has injected the fatal dose inside the body or not. It will be like this. You must have seen in National Geographic or Animal Channel that the snake is going to bite like this and going to inject the poison which is enough to kill that animal. That this poisonous snake is going to bite the animal. That is another story. There are a few of the snake which start spitting and they make blindness. There are a few of the snake which go around the body and squeeze the body and make traumatic asphyxia. There are a few snakes which make myotoxic, which have a myotoxic venom, and there is a muscle fatigue and the person, he gets drawn in water. There are a few poisonous snakes which make bleeding disorders because hemorrhagic disorders and there are poisonous snakes which make bleeding disorders. There are poisonous snakes which make a neurological sign symptom, and they are very dangerous. By the way, the cobra, king cobra, they are most dangerous snake all over the world. The cobra is coming in a classification of elapids. The head is equal to the size of the belly. The head is equal to the size of the belly. It is 1 yard to 10 yard long. Pupil is round, just like a human. And viper, it is less than a yard long. It likes to stay round and round and round like a viper, Russell viper, pit viper, etc., bamboo viper. And there is a sea snake, which has a, and in viper, the head is triangular, mandible is outer, is larger than the size of the belly. The head is larger than the size of the belly. And the sea snake, it has got a myotoxic venom, and it is having a head smaller and tail-shaped fin. This is sea snake. So king cobra, common crate, Russell viper, saw scale viper, most common poisonous snakes are available. That is called crate. Crate is a type of one. The snake is going to bite for two reasons. One is for business bite, that like to eat frog or a mouse, will go near, will attack, get hold of that rat from the neck, start injecting the poison. These are the fangs. Start injecting the poison and will keep on giving injection, and after that will leave and stay away. You will find that the rat or a frog will die because of some reason, and after that will engulf and swallow, and the enzymes will start working and used in digestion. Second is in a defense. Snake is going to bite in a defense when feel that somebody is going to attack him, will bite and will run away. This is in defense. So business bite and defense bite. In business bite is going to give all poison. In defense, maybe will bite, will run away, will get frightened, will run away, give little amount of poison. So most of the time, this poison, little amount of poison, when it will go towards the heart, will get destroyed by the immune mechanism. And you know, the venom, it get absorbed from open skin. It gets absorbed when it is being injected. But if this venom is being taken by the, by orally, by the mouth, it will be destroyed by GI enzymes. But in this part of the world, we have few misconceptions. People, they say when you kill the snake, you just crush the eyes of the snake, because the image will be made in the eyes of that snake. And when the image is being made in the eyes of the snake, if the snake has bitten a person in F8, Islamabad is going to take revenge in phase 8, Karachi, DHA Karachi. How it is possible? It's misconception. Another thing is, when the snake bites, the senior of the area, or maybe, I don't have any controversy in anything, but I'm just telling you our medical point of view. When the snake bites on that Hari's right knee joint, the people, they give incision and ask another person to suck the blood. And the book says, if you give incision and you start sucking, you can withdraw 20% of the poison, not more than that. You can withdraw 20% of the poison, not more than that. And obviously, when after that person, he will become all right, he will recover, maybe you have cut the common perineal nerve. Few of the people, they say, well, you just burn that area with the hot iron rod, like the area which has been, so you destroy the musculature, vasculature, or maybe tendons, or maybe whatever, nerves. So the thing is that there are few misconceptions. What people, they do is, they give an incision, they put capsicum powder over there as well. These are all misconceptions, frankly telling you. Coming to the point, the snake venom. the God has given this poison in animal, and this poison is called venom. The venom is the poison in snake only. You never call venom in opium or maybe in heroin or in any of the other animals' saliva. In a dog bite, only the venom is in the. There are a few functions of the venom. The functions are, this is to immobilize the prey. The God has given the venom not to bite a human being. It is been given to paralyze the prey, and it assists in digestion. The composition of the venom, it has got many toxic substances, many kind of enzymes, and in fresh state, it is transparent, clear. Those students who have visited snake farms, and over there they have taken out the venom, and the person has taken half of the glass of the venom by mouth, nothing will happen because it will be destroyed by the GI enzymes. But depending, the person is having a dental caries, person is having ulcer, duodenal ulcer, or maybe any kind of ulceration is there, the person will die before that person who has been bitten. This man who is sucking, or the person who is taking the poison will get absorbed more earlier from. In a dried type of venom, it is yellow granular masses which remain active for many years, and most of the time these snake charmers, when they come and they convince you and they just advise you that have a I will show you the show, and I will give you one of the gift, and this gift is having activity against the venom, and it has got toxalbum and several other toxic active principles, and it is in a dried form. So the snake venom, it has different kind of components. It is important for PCQ point of view. There are a few of the snakes. There are cobrides, viperides, or maybe sea snake. They have the ingredients, or these non-toxic poisons, so the poisonous snake, they have in a little amount. It is being used for digestion. It is being used for getting hold of a prey, like a fibrinolysin, hemolysin, cardiotoxin, hyaluronidase, or maybe coagulase, or phospholipase, or thromboplastin, or the proteolysin. These are the ingredients of the venom. There is so much noise at your place. Alhamdulillah, there is noise pollution over here. I was telling my attendant that I take classes in one more prestigious institution. Over there, we have such a good atmosphere, and now I can see from the glass. It's not a looking mirror, but I can see at my back there are so many classes going on, and what to do. We are in a digital area. I'm sorry for that. Now the types of snakes. I told you, these are all poisonous snakes. We are not talking about non-poisonous snake. We are talking about poisonous snakes only. The types of the snakes are elapids, viperides, and sea snake. The elapids mostly has got a neurotoxic venom. And elapids are cobra, king cobra, crate, which is most commonly available. And these are the elapids. It has got a neurotoxic venom. When it will bite a human, the poison, if it is in a fatal dose, will enter into the circulation, will make a ptosis. Person will not be able to shout, will have a paralysis, will fall on the ground, and non-availability, the anti-venom, will increase the chances of death. If he dies, he will die because of the paralysis of the diaphragm, and he will die because of this. In case of viperides like to stay round, like a Russell viper, like a pit viper, like a bamboo viper. They are of different colors. They are small. They have a triangular head. Their pupil is vertical. They like to give young ones cobrites or a cobra crate. They lay eggs 200, 300 at one time. But viperites, they lay young ones, and the viperite's head is triangular, mandible is outer, and will have a bigger head than the size of the belly, like to lie round. When will bite a person, they will be swelling, inflammation, edema, necrosis. They will be swelling, inflammation, edema, necrosis, and you will find they will be bleeding from the mouth, nose, ear, and the site of the bite. You have to make a DD of a bleeding from mouth, nose, and ear, like in a pontine hemorrhage, like in a road traffic accident, like in a strangulation, and like in a viper bite, like in a hemorrhagic disorder, the person will start bleeding from mouth, nose, ear. Like these days, we are having a dengue and the platelet count is going down day by day, etc., etc. So viper, it has got a vasculotoxic venom, and when it has got a vascular, it will have a fibrillizine, it will have thromboplastin, it will have hemolyzine, etc., etc. Then we have a sea snake. The sea snake venom is mainly myotoxic. When it bites a human, person will have a fatigue. He will have a muscle fatigue, lethargy, and will be brought to the ER just like he is on a hanger or something. And because myoglobin is drained through the urine, and you will find green color urine will be there because the myoglobin, urea will be there. But one thing I tell you, we live near the coastline area. People live in Bombay, people live in Bangkok, or maybe Pattaya, people maybe live on the seaside areas, but hardly these sea snake cases report because of it's a big sea, the snake will run away, one point. Secondly, when there is a shipwreckage or maybe in the nets of the fishes, when the snakes will be trapped, they are being thrown in the water. At the time, maybe they will bite. Little amount of poison will go in the blood, etc. But the sea snake cases, they have a very small teeth. They have a very small, they hardly can penetrate through the pads. And second thing, when the person will get muscle fatigue, he will get drawn in the water. He will not come and report. He will get drawn in the water. And so sea snake cases hardly, report. Biggest point is that they escape away. Secondly, they have a very small teeth. The most longest teeth have got a viper, which is coming out from the mandible, and they have a long hypodermic needle type of a teeth, which is having a pipeline coming, which is called canalized teeth. There is a pipeline being connected with the parotid gland, that is a poisonous sac, and they just bite with the hypodermic needle type of teeth, and the person gets more poison or a fatal dose at one time. The types of snake bite I told you is a business bite or a defense bite, and then the treatment of snake bite. In treatment of snake bite, I must tell you that in different cases we have different type of treatment. Like when you are going for a heroin withdrawal, you need to make a psychotherapy of the patient. You need to convince the patient. You need to take the consent from the patient that you are going to stay away from this. When you are going for the alcohol withdrawal, you are using anti-abuse therapy. You are going to convince the patient, look, you are not going to take the dose. Look, you are not going to take this. You need to take this this tablet that is anti-abuse therapy. I'm going to withdraw it. Same way in case of a snake bite. You need to allay the anxiety. You have to reassure the patient, look, you have not been bitten, must have not have been bitten by a poisonous snake. Maybe most of the snakes are non-poisonous in nature. In this part of the world, there are like 250 to 350 species of snake, out of which only 50 species are poisonous. Look, even if the snake was poisonous, must have not have given you, was coming from a hibernation period, maybe not has given you the fatal dose, etc., etc. You have to allay the anxiety. Otherwise, most of the people, they die because of the neurogenic shock, because of the anxiety or a fear. They die from a non-poisonous snake bite. Then you will try to avoid the spread of the venom. How you avoid the spread of the venom? If the snake has bitten here, you will just apply a pressure bandage all over the limb, and you will put in a resting position. If the snake has bitten on the lower limb, you will apply a pressure bandage, that is a crepe bandage, because the spread is not through the veins or the arteries or not, the spread is through the lymphatics. So the lymphatics, you keep a firm pressure on the lymphatics, and that will delay the absorption. If the snake has bitten here, or on the body, you just put in a lying position, and most of the time the bitten part is below the heart, and it's in a hanging position, etc., etc. And in old days, we were using a tourniquet. Tourniquet was a piece of rubber tube, mostly cycle tube, that was being cut, and the tourniquet was being used. This tourniquet they used to put proximal to the site of the bite, and the rule is, again, I will not repeat it again, the tourniquet is being obsoleted, because the tourniquet, when you apply a tourniquet, maybe you will make, that area will become gangrenous, etc. As a rule, you have to release for 10 minutes every hour. And you, as I told you, that the spread is not through any of the vein or any of the capillary, or it is through the lymphatics. So you put a firm pressure, but tourniquet is applied on a single bone, either on this humerus or either on the femur, proximal to the site of the bite, and it is being applied on a single bone, not double bone, 1 point. But we are not using this. We are using pressure bandage. We are putting the patient in a resting position, and use of anti-venom and other antitoxic substances will be given, and non-availability of the anti-venom will increase the chances of death, the anxiety. Death from shock due to fright and fear can occur even in non-poisonous snakes. You reassure the that all the snakes are non-poisonous. The snake poisonous was fully charged, has not injected you the poison in a fatal dose. If injected, has not given you that amount. Immobilization of the bitten part to decrease spread by lymphatic and circulatory system by decreased movements. You will put in a lying position, or to decrease the pain, you will give painkillers. If lower limb is being bitten, ask the person not to move, and if the upper limb is being bitten, use a sling and put in a resting position. Application of ice pack and other things. Totkas are not allowed, and increased pain there may be. There's a long stories about poisonous snakes, and there are few of the people who have a knack of treating the poisonous snake. But I have no controversy in all other things. There are buzzards, there are, they recite Holy Quran, verses from Holy Quran, and it works. They have a knack of treating. I know few of the families who have knack of treating these snake bite cases, and these snake bite cases are very common in the province, or in the interior, or in the fields, or where the people are living in the these townhouses, these houses, and on the fields, etc. So I told you the tourniquet about it, and that you apply tourniquet proximal to the site of the bite on a single bone, etc. Then we have use of anti-venom. When you reassure the patient, you immobilize the part, you apply a pressure bandage, you shift the patient to the hospital. Over there, obviously, you don't have anti-venom everywhere. You shift the patient to the hospital. Use of anti-venom will be there. Anti-venom is of two types. One is called specific anti-venom against that particular snake, like against the viper, against the cobra, against the sea snake, etc. The venom is being injected in a horse, and antibodies are being made, being extracted out, and they make the anti-venom against it. Then we have a polyvalent, and the polyvalent is against 4 snakes, and like cobra, crate, viper, or sea snake. And these are the things, polyvalents are being used. And most of the time when we are confused, or when we are dealing at a poisoning unit in JPMC, which is funded by WHO, they are using polyvalent against the snake bite. And the mortality by all these type of snake bite is 40%. Adequate anti-venom treatment will reduce the risk less than 10%. Anti-venom can be given even after delayed serum sickness response in common. Fatal anaphylactic reaction may occur because of the. So polyvalent is against the 4 snakes, and specific anti-venom against that particular snake. Nothing like that. How much is being given? It is given like 3 to 5 ampules you put in a trip, and you finish in 1 hour. And 3 to 5 ampules you are putting in a saline, and 1000 ml saline you are finishing in 1 hour. And if the symptoms are subsiding well, if they're not subsiding, repeat the same dose. And this it retains its potency for 10 years, given before, after the test dose. As I said, 3 to 5 ampules are being put in a saline of 1000 cc. And we are also, according to our book, it says that you will give 20 cc of anti-venom is given intravenously, slow IV in 100 ml saline, and 20 ml you give IM, and 20 ml you will give subcutaneously. And IV dose can be repeated if collapse occurs every 6 hours till symptoms disappear. When the patient is being admitted, if the poison is very toxic, the snake was very toxic, you need to keep on repeating the dose, and you go up till 20-25 ampules of. And if coagulation abnormalities are not corrected by anti-venom therapy, it may be necessary to administer fresh whole blood, fresh frozen plasma, and different factors can be used, and hypotensive shock can be managed by anti-venom therapy, foot and elevation, and vasopressor like a dopamine infusion may be given. Neurotoxicity is being made by obviously all patients with neurotoxic symptoms because of the cobra. Cobra is the most toxic snake, and in cobra there is ptosis, the person is unable to shout, person will get paralysis, he falls on the ground, etc. And in case of a viper, there will be swelling, inflammation, edema, necrosis, and there will be bleeding disorders from bleeding from mouth, nose, and ear. In case of a sea snake, there will be myotoxicity will be there, myoglobinuria will be there, and muscle fatigue will be there, etc. But neurotoxicity, because of the cobrites, all patients with neurotoxic symptoms should be given anticholinesterase therapy with neostigmine, methyl sulfate, 5 to 100 micrograms per kilogram, and atropine sulfate, 15 micrograms per kilogram by subcutaneous injection every 4 hourly, occur with a continuous infusion, IV infusion. If the patient is able to swallow, give neostigmine orally 15 milligram 4 times daily with atropine 0.6 milligram twice a day to counteract bradycardia caused by neostigmine. Other general measures, you will give a ATS injection of 1500 international units. In case of a child, you will give 750 international units, etc. You will give steroids to avoid shock. You will give antihistamine. You will give sedative for excitement, or you avoid giving the morphia, etc., etc. Artificial respiration can be given. Antibiotics for prophylaxis against infection can be given. The universal fear associated induce a state of shock, bite site, maybe multiple teeth impression, lack of significant local pain or swelling, adequate assurance and symptomatic treatment may lead to full recovery. Off the record, I tell you, there is one of the snake in Pakistan, especially Sindh, which is in a rice canal, which bites a human. It has a local anesthesia. The person will not be able to decide that what happened to him, because it's a painless bite. It's a small snake, and it is a painless bite, and the person slowly, gradually, he dies because of that poisonous snake. That is called a sunchu in this area. And I tell you, the area where you practice, if you are working somewhere in Saudi Arabia, they will call by their names. If you are been working somewhere in Sindh, obviously the person will say that maybe this lundi has bitten me. So you need to know the local names of that snake or that poison, or that if the person is going to report to you, they are not going to tell you the botanical name like Ricinus communis. They will say Arandi. I have eaten Arandi, or I have taken accidentally the Arandi, etc. So you need to know the Urdu name and the local name, etc. The elephant bite has instinct fang marks and burning pain, swelling, because there will be a burning sensation from the site of the bite, and swelling and discoloration will be there, and some kind of stereosanguinous type of a discharge will be there as well. Then pre-paralytic stage, the person will have MSS, headache, ptosis, ophthalmoplegia, drowsiness, dysarthria, dysphagia, convulsions, bulbar paralysis, ultimately paralysis of the diaphragm. In short, there will be ptosis, he will be unable to shout, he will fall on the ground, he will get paralysis, and he will die if he is not being attended properly, if the anti-venom is not being given properly. Then he is going to die from paralysis of the diaphragm, etc. And the cause of death, respiratory failure. Vibrites, I told you the local features are there: swelling, inflammation, edema, necrosis, blister formation, big blisters will be there, bleeding from the site of the bite, etc. And there will be severe pain from the site of the bite. Generalized type of a bleeding manifestation, the person will have bleeding from mouth, nose, ear, and the site of the bite, like epistasis, hemoptysis, bleeding gum, hematuria, purpuric spots, renal failure, etc. will be there. And hydrophyte, that is a sea snake, the local features will be minimal swelling and pain, and systemic features, myalgia, muscle stiffness, myoglobinuria, renal tubular necrosis will be there, etc., etc. Now, how you make a diagnosis of a snake bite? You look at the fang marks. You take the history when the patient reports to you in anxiety, tension, and he is in a shock. You will just try to make diagnosis from history, from signs, symptoms, signs, what he is telling you, what you can see, and symptoms, what he is telling you. And you will look at the fang mark, where it has bitten. You will see there are 2 teeth marks, or there are series of teeth marks. If series of teeth mark, it has been bitten by a non-poisonous snake, you will go for a symptomatic treatment. So classically, there are 2 fang marks, 2 punctured wounds separated by a distance varying from 8 to mm to 4 centimeters, depending on the species involved. However, a side sweep may produce only a single puncture, while multiple bites could result in numerous fang marks. And the identification of whether it's snakes, you will try to find out whether it is a poisonous or non-poisonous. If it is a poisonous, you will try to establish your diagnosis that whether it's bit by cobra, by history. You know how you establish diagnosis of a snake bite. Number one, history. Number two, sign symptoms. Number three, laboratory investigations. Number four, circumstantial evidence. Now, very interesting. Sign symptom, history. He will give you a history. I was going there and one of the black snake started charging me and became like this, and the head was very big, and it was, I think, king cobra or something, and came out, I don't know from which side. It was jet black, and it was nearly 2 yards long, or one and more than a yard long. And I was trying myself. I got frightened and I started running, and it came and jumped and bitten me on my leg or on my thigh, etc. So the history is available. Signs, what he's telling you, he's telling you, Doctor Saab, saans nahi aa rahi. Doctor Saab, I'm having this. Doctor Saab, I'm having dyspnea. Doctor Saab, and the symptoms you can see, and the symptoms what he mentions you. Signs you can see, the ptosis is there, paralysis is going on, etc. And symptoms he will mention you, Doctor Saab, I'm having this, I'm having that. You will take the blood, you will do the symptomatic treatment, you reassure the patient, you immobilize the part, you apply a pressure bandage, you just put him on a couch in a separate area, you will maintain the IV line, you will ask the attendant or the laboratory people to take the blood and say, within 10 minutes you will get a phone call, sir, cholinesterase enzyme is very high, hyaluronidase is very high, or this is cobrite. If he says fibrinolysin is very high, or hemolysin is there, etc., your mind will go towards the vibrites. Now the poisonous, non-poisonous snake, I told you about it, and the scales are all over the body, and non-poisonous snake only on one side, and the saliva has got the venom, and the venom has got toxic substances and different enzymes. Treatment protocol. Deaths have been reported from shock due to fright, even when the bites were non-poisonous snakes, as I was telling you again and again. It's vital to reassure the patient. First thing is you have to reassure the patient that it was not poisonous, and it was not all poisonous snakes fully charged with the venom, even though those they are fully charged do not always inject the fatal dose, has not given you, must not have given you the fatal dose, and reassure helps reduce anxiety related high blood pressure, palpitation, tremors, sweating, rapid breathing, etc. What to do immediately? You have to, according to the American standards, these steps should be taken, that wash that area with the soap water, the bitten area with the soap water, immobilize the bitten area, and keep it lower than the heart. Like if it's on the hand, you just put in a lying position on a stretcher, get medical help, shield the patient. And what not to do is not to give the incision, not to go for a suction, not to burn that area, not to give an incision and put a capsicum in that area, not to give any electrical shock, no, not to incise the wound, etc. You will disturb the vasculature, musculature, etc. Under medical supervision, you will give administration of the anti-venom, and the anti-venom is available in all the big hospitals, and either specific anti-venom, either polyvalent is being given, specific against that particular snake, when your diagnoses are proper and you are very clear about it. But if you are not clear and mixed type of signs, symptoms are there, and I was telling you, you establish your diagnosis on the basis of history, signs, what are seen, symptoms, what he tells you, laboratory investigation, cholinesterase or a fibrinolysin or hemolysin or proteolysin is there. And number 4 is the circumstantial evidence. When a person, he attempted suicide with a barbiturates, the bottle will be on the bedside. He is not going to throw in a jungle. If a snake bites a human gets mad and he goes behind the snake and will get hold of that snake or will kill that snake and will bring in a jar, and the snake is so hardened that for some time, maybe because of pithing, because of the injury, because will become unconscious, but later become conscious, and they bring in a jar. And most of the people, they bring this snake, killed a snake with them in a jar. Doctor Saab, this was the snake which has bitten me. So circumstantial evidence will be there, and you will be knowing in my museum, in Dow International, in Dow Medical College, in JSMU, in AKU, in all the other colleges. We have the snakes in the museum. You can go and you can just identify them and you can make a diagnosis. There are specific anti-venom can be injected, polyvalent if there is a confusion or mixed type of signs symptoms, either you give a polyvalent which is against the 4 snakes. You will give one version is you will give 3 to 5 ampules and you finish in 1 hour, and another version is you give 1/3 dose subcutaneously, 1/3 intravenously, and 1/3 of the intramuscularly. Intramuscularly, subcutaneous. The intravenous dose can be repeated every 6 hours till the symptoms. The management antivenom acts only against circulating toxin, not toxin fixed in the tissue. The symptoms which have started appearing, it will not reverse that. With basically, antivenom is going to work, make action with the circulating toxin, and therefore specific measures has to be taken in case of a neurotoxic sign symptom. Atropine may be given subcutaneous, should be followed by 5 injection of Neostic, means 0.5 milligram intravenously repeated 2 hourly, depending on a response to reverse muscle paralysis. In case of a vascular toxic signs of symptom, fibrinolyzing along with the heparin may be given, but with extreme caution and constant monitoring, as heparin can intensify bleeding. I'm waiting for your questions as well. This is somewhere from a Parveen Kumar book of medicine. You will give a supportive treatment. There is an include blood or plasma infusion to combat shock, mechanical respiration to combat respiratory distress. Antibiotics may be given for avoiding any secondary complications, and neuromuscular paralysis is the most dreadful complication of the snake bite. It may occur within 15 minutes, but may be delayed for several hours to tackle hypersensitivity reaction to anti-venom, steroids, adrenaline, and antihistamine may be given because these vaccines, these things, they produce hypersensitivity state. It is given in the Parveen Kumar book of medicine, and the firm pressure or bondage is being done, greatly delays the spread. Anti-venom not generally indicated unless systemic effects are present. You will not give just for fun. You will not give unless and until there are signs, symptoms. Careful observation. You will keep the patient. Anti-venom must always be given with the indicate. Supportive measures are being given when, for anxiety, we'll give diazepam or IV fluid with volume expander. For hypotension. Specific measure anti-venom can rapidly neutralize the effects. This is about the snake bite. When a patient reports to you with a snake bite, you just reassure the patient. I'm expecting your questions. When a patient reports to you, you will try to allay the anxiety. You will just make the reassurance of the patient, and you will establish a diagnosis on 4 lines: history, signs, symptoms, laboratory investigation, and circumstantial evidence. After that, you will get confirmed from the report, and you will get confirmed from the signs, symptoms you are having, observing that ptosis, paralysis is going on, and on a report, cholinesterase enzyme, hyaluronidase enzyme is high, so cobrides are there. So when the cobrides are there, how long does a snake bite patient should be monitored? Up till the time when he becomes all right. As I told you, that our snake bite cases with a poisonous snake bite, they report to us after nearly like 18 to 24 hours. They report to Jinnah Hospital, they report to Civil Hospital, they report to other private hospitals, and we have snake bite cases reporting over here. And most of the time we have these snake bite cases in JPMC poisoning unit Ward 5. And you have to monitor these cases up till the time the symptoms disappear. The person becomes all right, because the poison will be in a peripheral tissue and will keep on showing the signs, symptoms, etc. You will, because of the poisonous or toxic effect, you will keep on monitoring and giving the anti-venom against that. And most of the time we are giving polyvalent, and we keep maintaining the IV line, etc., and symptomatic treatment is being done. So this is what we are going to do. But as there was a slide, unless and until there are signs, symptoms, you are not going to use the anti-venom. And how much anti-venom you are going to use is 3 to 5 ampules, put in a drip and finish in 1 hour and subside. Symptoms subside well, otherwise repeat the same dose, etc., etc. Any other question? Any other question? Okay. No question? Okay. I think we finish up till here. We will be giving, we have already floated assignment for sexual. Okay. We have already floated the assignment for sexual offenses, sexual perversions. I'm expecting your, I have got most of the students have submitted. Few of the students have not submitted. You know, we are giving marking for that, and it will be included in your exam for the internal evaluation, internal marking. And please submit your up till today, 12 midnight. And I will be giving you assignment for snake bite as well. Thank you very much.